The Monroe County Health Department recently released its overdose data from 2023, reporting an increase of nearly 200 overdoses from the prior year. Health leaders say they're working to bring those numbers down in 2024 and feel confident in their efforts. But critics argue there's much more to be done and say the data was released too late in the year to have any impact. News 10 NBC's Tom Kowalski reports.
512 people are dead from overdoses in 2023 in Monroe County. That's according to data that was released in November from the County Department of Health. But why did it take so long for the data from last year to release to the public? Other New York counties like Erie and Onondaga released their data several months ago.
Some of the testing is just very detailed, very specific, and there's certainly the question of volume. I know those are other counties are also, have a significant population as well. But our medical examiner staff, according to national standards, should be staffed with 5 medical examiners, and we only have 3.
Public Health Commissioner Dr. Marilena Velez de Brown says it's due to a nationwide worker shortage.
Medical schools are just not graduating enough pathologists, much less those going into forensic pathology. So there are more openings nationally than there are individuals to fill those positions.
But critics like Jim Van Bretterode says the county previously outsourced some of the work to NMS Labs in Pennsylvania and asks why they can't do it again.
Data that's old is worthless. So we have no idea. What are we going to do this year? Because the data's a year old. You know what I mean? So how are you supposed to address a problem when you don't have up-to-date data? That's a problem. And that can be fixed if we just outsource some of these testing results, send them down to a private lab, and get caught up on all these testing results.
Others, like Randy Semino of Gates to Recovery, feels the increase in overdose deaths comes from fentanyl coming into the country.
It's a direct result of our wide open borders. It's a direct result. The fentanyl is incredibly bad, man. It's just flowing in at a rate that's unreal. So I don't know what to say about that. This is a mental health issue. It's a mental health issue. I've been pushing that since day one. I know that. I was the next drug addict. I'm in recovery. I've been in recovery for years.
Tom Kowalski, News 10 NBC.